now start letting people in. All right, we are getting ready to stream now. Welcome, folks that are coming into the meeting. If you were looking for the Healthy Outcomes event, you're in the right place. We're going to get started in a couple minutes. Going to let people get themselves together in the next couple minutes here. Try to get all of our my little background sounds together and turned off. Thank you everyone for joining us today. All of our folks on Facebook that are joining us today, thank you. Watching the stream, you gotta get a chance to be able to join us. If you are in the Zoom right now and you want to share your name, what organization you're with, or what city you are in, please feel free to do so. Same thing for you folks that are on Facebook. Please feel free to do the same thing. Say your name, your city, or who you're representing. We want to have people interact with us and have a good time.
That's fine.
We'll get started in a couple minutes here. All right, let's get this list to you here. Our order. All right, hey Tango, we're here for you in a couple seconds too. We'll get started in just a couple minutes, waiting for folks to get themselves all situated here on Facebook. This is the third of our community conversations that we've been having in 2020. Hope we will have some more in 2021. Hey, Rob, how's it going, Lori? All right, we're gonna get started. Just a second. I'm gonna pull up a document so you guys can see that. I see. Actually, 1 second. I have to do one more thing here. Got a little bit of a sound. All righty. And our folks joined in. Thank you so much. All right. One more minute and we're gonna pull up a document so you guys can follow along. All right, so we will get started in 1 more minute. Give it 1 more minute for us to get our Facebook crowd together. Adam's joined us. We've got all of our folks that are speaking today. Already feels like it's been a long week and it's only Tuesday. So really appreciate everybody jumping on in the evening, sometime between dinner and bed. Really appreciate that. Started in about.
I felt that same way, Merle. I think that was Thanksgiving week. I was like, I've only been here for 3 days this week, but I've been through a lot in those 3 days. Yeah.
Getting a lot done.
Getting a lot done.
All right, so I'm going to open up the room so we will just let people join the Zoom as need be. And then folks on Facebook, so much for joining us. And anybody who is jumping into the Zoom right now, please feel free to put your name, the organization you're representing, or the city that you live in. Really appreciate you joining us. I am Merrill Holloway. I'm the executive director of NC 100, and I'm going to be sharing a quick slideshow with you guys, and I'm welcoming you to our third conversation talking about how do we create and protect more healthy outcomes. Let me get ready to show a really quick slide deck here. Can folks see that slide? All right, very cool. I'm going to leave up the slideshow presentation. So this is our Resilient Community Conversation 3, sponsored by NC 100 and also the Rockingham County Racial Equity Learning Community. I want to tell you a little bit about these two organizations, or the two folks that are sponsoring this conversation. NC 100, again, I am the executive director of that organization. We are a nonprofit organization connected to and working directly with local and statewide leaders. We've been operating in some shape or form since 2011. We did some work under another name, actually the Rockingham County Champions for Education, but we have expanded and call ourselves NC 100 now. And we're doing some really cool work supporting a lot of different things, but looking to improve our community, build partnerships, and support a lot of good work. We also have been working really closely with the racial equity learning community, and I'm going to let Ms. Tango Moore step in real quick and talk a little bit about that work, and then move forward and tell you how we got here to this third conversation. Tango, you want to talk a little bit about RELC?
Yeah, my daughter's phone's ringing.
No worries.
Okay. So basically this work started with the Rockingham County Partnership for Children and RAF leadership. We got different people across different sectors together to come together and learn about racial equity. And that work began in 2016 and 2017. We formed this group. Oh, my bad.
No worries, life happens.
We formed this group, and we have been working together since that time. It is open to anyone in our community who wants to come together and support our mission, which is to deepen understanding of racial equity. And our vision is to just advance racial equity. And so we have, initially, it was all 100% learning and relationship building together to, hear from people with different perspectives from different racial backgrounds, and to kind of create those relationships that start with us internally and in our smaller circles and build out into our workspaces and our institutions. And we are represented by quite a few nonprofits in our county. We're happy to say that. Also teachers and some central office administrators, the faith community, the health community, and we welcome anyone else who would like to join us. So the membership expectations, it's really not a whole lot expected. We would like you to, chime in and be in meetings as much as possible, but really a commitment to just interrupting or disrupting certain things that you see in, on any level. You could hear a conversation happening at work that, isn't promoting equity. And, you could pull that person aside and tell them, hey, I'm learning some things and I would like to invite you in as well to learn alongside me. So it doesn't have to be very confrontational, but it is an open door. If anyone's interested, please let me or Merrill know. We do have a Facebook account. I think it's Rockingham County Racial Equity Learning Community.
Yep.
And just get in touch with us. We would love to have you guys, and a lot of the panelists today and a lot of the participants are active members, and we appreciate you guys.
Thank you so much, Tango. And for you folks that are watching on Facebook, we will put some of that, we'll put stuff here in the Zoom chat, but we also will post some of those things on the Facebook Live channel. Thank you so much, Tango. How we got here. So as Tango said, there's a lot of conversations that have been happening across the county, doing work with the equity lens, learning, having shared language, nonprofits, churches, work groups, and things like that. And we actually got together this summer and had a conversation with the chief of police this summer, probably a month or so after some of a couple of tragic events that happened, most notably George Floyd. And we've been dealing with this pandemic and a lot of some civil unrest and just young people wanting to be civically engaged. And we talked a little bit about some of the policies that the Reidsville Police in particular wanted to make sure that the community knew about. We did a deeper dive into some of those policies and some of the work they had been doing in October, and we talked about public safety and community trust. We followed that up with a conversation in November about economic and social justice. So we included groups that were doing work, nonprofits, businesses, individuals, people who were from Rockingham County doing work in Wake County, people doing work in Graham, all types of folks that were contributing, people who weren't from Rockingham County but had ideas to share in a conversation we had back on the 17th. Then the next call was to have this conversation tonight about how we can create and protect more healthy outcomes. And so we've got so many really great people that you're going to hear from that will share some of the stuff that they do. But we really hope that this will be a super interactive conversation. And for you folks that are on Facebook, we really want you to ask questions. For you folks that are here in the Zoom, we want you to ask questions as well. And then hopefully there will be more conversations that we have down the road. So you see, like the next conversation, we have no idea what it will be about. It may be some mashup of these three. We don't know. But hopefully this will be, this is conversation 3, but hopefully it'll be a few more. Quick before we get into this and I stop talking so I can get us into the actual meeting. Just want to have a few commitments that we are making for you tonight. Number 1, transparency and honesty. We really want to make sure that you guys know as much as you can. We're going to share as much as we can. We'll be as honest as we can and share as much as we can. If we don't know the answer to something, we will not. We will definitely tell you we don't know, but we can get back to you. If there's anything that I can figure out and help, get information out, we will share information on our NC 100 page. If there's something that we really need to get back, if somebody really raises an issue that needs to be answered, or at least an arrow pointing to where you get those answers. We're gonna make the most of our time. This time will zip by. We will try to take care of each other. We will talk about problems, not necessarily talking about individuals or anything like that. We're going to talk about our systems, that sometimes our systems don't take care of everybody like they need to, but we'll try to attack some of those systems and not people. We're going to be very aware of the space that we are in. So folks, if you have any background noise, be aware of that. If you're not speaking, have your mute on. If you have a lot of things that you want to share, be noticeable, then notice how much space you may be taking up in the room. We don't have a ton of time, but we do have a nice time to get some conversations going. And then we're going to try to get you out of here on time. So we know people are using Zoom a lot, and giving us from 7 to 8:30 is a big commitment, and we appreciate it. So the next voice that you are going to hear is going to be Mona Lisa Mccorkle, and I have had the pleasure of being able to work with her in the racial equity learning community. Got a chance to meet her just on happenstance on some entrepreneurial adventures with NC Idea. Just randomly, we happened to be on the same bus doing some tours of. I think we were going out to Gibsonville to tour a place, and she's a Rockingham County native like myself, and she's going to talk a little bit about herself and her background, and she will be moderating the conversation tonight. And I will go ahead and pass it to her, and we're going to have a good conversation. So Mona Lisa, thank you again for moderating this conversation, and I am going to step back and let you run it. And folks on Facebook, please continue to put all these really nice comments that I'm seeing, and folks in the Zoom, let's have fun.
All righty. Good evening again, everyone. My name is Mona Lisa Mccorkle. Again, I am actually honored to be here with the esteemed panelists who are guests with us on tonight. Again, I am an Eden born, actually Eden raised, moved away for about 30 something years after having graduated from Moorhead High School. And then so for the last 4.5 years or so, I've been back in the area, and I'm excited to be back in Rockingham County. But I want us to have some fun tonight. And the question has been raised, how can we create and protect more healthy outcomes? And one of the things we want authenticity in its true form tonight, because we want to be honest, we want to be open, we want to be real. And so we have many speakers, many panelists who are going to come on, and we understand data and the necessity of data. However, given where we are, given the present time and circumstances, I want us to be real with our conversation. And for those of you who are joining us via Zoom or via Facebook, please feel free. This is not a one-sided conversation, or we don't want it to be, because it's for you as well. And again, we have phenomenal panelists who are a part of this. And so as they speak, if you have questions, please feel free to chime in, ask your questions. Don't be afraid, because the only way that we can ensure that this is something similar to a town hall conversation is that you participate. You know what, don't hold it, let it out. So we're going to try to get through this as quickly as possible. Again, we welcome you to this live. Thank you in advance.
All right, go ahead, Melissa. Go ahead. Introduce
no, you take it up, take on, go on.
We are very honored and very happy to have two of our bright, shining stars, Moorhead High School students joining us that will be looking through the Zoom chat. So we definitely, so like Melissa said, as folks that are in the Zoom, please interact with us, ask questions. Our students will be working with you, and they will be introducing our panelists. We have Georgina and Rita. We will let them introduce themselves really quickly. We'll start with Rita.
Hello, everyone. I'm Rita Tariq. I'm a sophomore at Moorhead High School. I'm also a part of the Health Science Academy at Moorhead High School.
Thank you. Georgina.
Hello, everybody. My name is Georgina Shigueri. I'm a senior. I plan on graduating high school and going to a four-year university. And thank you for having me here.
All right. And now they will introduce each one of our special panelists that are here tonight.
Calvin Allen, Director, Rural for North Carolina.
Dr. Vita Bland, Bland Clinic.
Katrina Chestnut, UNCG Partnership School.
Dr. Stephanie Ellis, Rockingham County Schools.
Jordan Jeffries James, North Carolina Cooperative Extension.
Cassie Mapp Ahmed, Village Sis Douala LLC.
Dr. Deidre Moore, Rockingham County Schools.
Liz Sedgwick, Rockingham County Partnership for Children.
Katrina White, Rockingham County Department of Health and Human Services.
Thank you so much.
All right, thank you all so much. So I suppose now is where we get into the nitty-gritty of what we're going to talk about tonight. And after having heard the introductions or, from everyone, or just a little bit about each person that's participating tonight, I'd like to ask each one of the panelists as we're starting out, just to share an opening statement, if you will, regarding how your work ties into health, whether it's mental health, whether it's physical, spiritual health, equity, but how what you do ties in with the conversation that we're going to be having tonight. And I'm going to actually just go from how I see people on the screen, if that's okay. So Dr. Moya, if you will go first, please.
Okay. So my job with the long title is Student and Family Health Education and Community Engagement Coordinator. And usually I get the question of what does that entail? And that entails the whole child wellness model. And if you haven't seen that, the CDC has a nice little picture of it, and it includes all components of health that you touch on in an individual. It goes, I tell people, from their head to their toes. So I do touch a little bit on the mental health piece. Dr. Ellis, she'll elaborate on that a little bit more, but I'm a part of the behavioral health department. So I work with that program. Then I work with our school nurses. And so that, entails making sure immunizations and stuff are done, and that, students are being healthy. And if they have like a pre-existing condition, they are able to address those while they're at school. Then I communicate with our child nutrition department, and then we local dentists, making sure that they come in and are able to do sealant projects. So I work with the state at the health department as well, with Katrina White, that she's also on this call. And then like I said, I just pretty much touch on everything. And then I also work with our community as well to ensure that we're able to bring in those community partners to establish those relationships, as well as secure grant funds. And with that, we have a school health advisory council, and we have lots of community organizations and lots of school system people that are on that board. And so we look at the policies and procedures to ensure that we have a healthy children's policy to ensure that our kids are getting their physical activity, their health education, and then also making sure that those partners are able to come in. For example, one of the partners that we work with wholeheartedly is called PlayWorks. And so that ensures that our students have engagement going on throughout the school day for play, because we all know that play helps our social and emotional status. So they have excellent programming that pairs nicely with all of our essential standards. So pretty much I'm linking our essential standards to that whole child wellness model to ensure that we have some healthy and productive citizens when our students finish Rockingham County schools.
Wonderful. Thank you so much. Next, I'm going to go to Elizabeth Sedgwick. And one of the things I want to say right here is, please forgive me if I do not remember what your title is. So I apologize in advance if I leave off a doctor or someone that's not listed with your name. So please forgive me in advance if I don't get that part right. But I do respect each and every one of you in your respective positions. So Elizabeth Sedgwick, if you'd go next, please.
Absolutely. It's a lot to remember. And I'm not a doctor. I supervise the Nurse Family Partnership Program here in Rockingham County. Nurse Family Partnership is a national nonprofit headquartered in Denver. So we're all over the country. I think we have about 14 sites in North Carolina. But our mission is threefold. We work to improve and enhance birth outcomes. And we also work with very early childhood. So we work with families up until the time that a baby turns 2. We enroll mamas early in pregnancy, and we're primarily a home-based visiting program. Obviously, we're not in homes right now, so things look really different for us. But we're super strengths-based. We meet families exactly where they are, and just kind of look at the family really holistically. And again, just work to optimize birth and child development outcomes, and also to optimize family economic self-sufficiency and work with families, especially moms, but kind of whoever the family entails, to meet kind of personal goals for growth.
All right, thank you so much. And next we have Dr. Stephanie Ellis.
Good evening, everyone. I'm so honored to be here with you guys. I'm Stephanie Ellis. I'm the Executive Director of Behavioral Health, Crisis Intervention, and Student Safety. And so our goal in Rockingham County is to build a equitable access for each and every student for a full continuum of social, emotional, and mental health services. And so sort of that belief that there's no health without mental health, right? And so we've been really working hard in our behavioral health department to provide a lot of wonderful resources for our students, where if they need cognitive behavioral therapy, they can access that, social emotional groups, mental mental health services, peer mentoring and tutoring, and conflict resolution. And then also just being able to have that support and resources for schools so that they know if they have a mental health crisis with a student, where to access those services and how to get that student support and help. So one of the really exciting things that we're so excited about is our whole team is being trained in teen mental health first aid, where we'll actually be able to teach teens to really go out and be advocates for their own mental health awareness, and to be able to chat with their peers and help connect their own peers, to resources and supports. So that's something new that we're actually working on right now. So we're really excited about that. So that's a little bit about what I do in the school district. The other thing that we have, I oversee our BETA team, which is our behavioral and emotional intervention assistance team. And this is composed of school psychologists, social workers, and behavioral health specialists. And that team, if we have a student in crisis, can help go and complete an assessment and help get that student linked to crisis intervention services. My background, I'm a licensed school psychologist, so that's a little bit about how I'm connected to helping the well-being of our students. So thank you for having me.
Thank you so much for being here. Next, Ms. Tina Chestnut, please.
Good evening, everybody. I come to you as principal of UNCG's Mall Street Partnership School. And in that role, one of the things that I get to do is work with a marvelous team of colleagues from both Rockingham County and UNCG. And in that role, we work collaboratively to try to stress the importance of recognizing barriers that hinder our students' educational growth. Specifically as related to health and wellness, and try to get access to health and wellness resources for our families. So that could range from everything from mental, physical, social, emotional, nutritional needs, and of course, academic needs. So from the role of principal, I am very fortunate that I get to sit in the center of working between UNCG and Rockingham County to bind those resources to help our school community.
Wonderful. Thank you so much. Let's see. Next, Dr. Katrina White.
Hello, and that's just Katrina White, but thank you. Thank you all for having me. I serve as a health education program manager and public information officer for Rockingham County Department of Health and Human Services, which our mission is to protect the health, safety, and well-being of our customers by providing essential health and human service in the most efficient manner. And we're also just committed to keeping our community aware, healthy, and safe. My connection with this topic tonight is because in public health, as you will go to, like most individuals, they'll go see their family doctor, right? And their family doctor would treat them. But in public health, the entire community is our patients. And so we have a responsibility for everyone, the community's overall health and wellness. And some of the things that controls or actually have a strong bearing on individuals' health is not just the physical, but it's the mental. It is the social determinants of health, where you're thinking about where they work, where they live, where they pray, where they stay, and all of those components. And so, and every one of them have something. If you lack in one, you're going to lack something in the other. And so what we're trying to do here is just make everyone feel inclusive and try to reestablish trust. People seem to have a bit of distrust with health departments in general, and then also with anything that could be remotely related to government. So at this day and time. And so what we're trying to do is erase the myth and just keep the information factual and just help people just try to understand that we're here to help and we're a part of what makes them happy and what makes them healthy.
Thank you. And next, Cassie Map Ahmed.
Peace and love, everyone. I'm honored to be here today. My name is Cassie Map Ahmed. My screen technology. Math on that. I am the CEO and founder of Village Sis Doula LLC. I am a doula. A doula is someone who provides physical, emotional, and spiritual support. We do not provide any type of medical services, but we are there to provide that support to increase the birth outcomes of individuals, regardless of what you identify as. We are inclusive doula services, but also specifically within the melanated community. We are 3 to 4 times more likely to die in childbirth. Also, the infertility rate within the melanated community, there's a lot of statistics there. But just as my dear friend Katrina mentioned, the village is the most important part of Village Doula, the village, right? Looking at the social determinants of health, the ecological model, interconnecting and networking in partnership with everyone in a community to address these health disparities, not only maternal health, but also the numerous different health disparities that exist in specific communities, and working collectively to address those issues. I'm honored to be here tonight, and I look forward to hearing from everyone. Thank you.
Thank you so much. And next we'll hear from Jordan Jeffries James.
Hi, everyone. My name is, like she said, is Jordan Jeffries James. I'm the Family Consumer Science Agent here in Rockingham County. Basically, I focus on food safety, health, nutrition, physical activity, as well as I am a certified personal trainer. And I try to incorporate that into a lot of my programs. But to give people an idea of what Extension is about and what we do, I think a lot of times people don't really understand what Extension does, but we are basically community educators. We are connected to both land-grant universities here in North Carolina, North Carolina A&T and NC State University. And what we basically do is take the research that both the universities are doing and provide programs to the public. And typically most of the programs are involved in some kind of agricultural practice. So we have agents in my office that focus on livestock, field crops, all that kind of stuff, home gardens, horticulture. But my specific focus area is family consumer science. So again, food safety, nutrition, physical activity, and all that kind of stuff. So that's basically what I do in a nutshell. But I provide programs such as Steps to Health, which is a SNAP Ed program. I do personal training, and most of my programs are free of charge or low cost. And also try to add in some recently some yoga as well, so for that mindfulness and mental health aspect of it as well. So that's basically what I do in a nutshell. Again, we are community educators, and we are a resource to the public. So if you have any issues that fall under our focus areas, just reach out to us, and we try to help out however we can. So, yep, that's me. Nice to meet you. Glad to be here.
Thank you so much. And Dr. Vita Bland, please.
Hello, everyone. I'm so happy and pleased and honored to be here with you today. My name is Vita Bland. I am a family medicine doctor, and I specialize in hypertension and diabetes. We try to take a holistic approach. So the bottom line is that I am here to educate, and I consider myself to be primarily an educator. I'm here to keep you as healthy as you will allow me to keep you, and keep you here as long as you will allow me to keep you here. So our job, and what I can see myself doing, is of course looking at disparities that we see within the African-American and brown communities, addressing those and trying to come up with solutions that people are willing to participate in and take care of themselves in a manner that elongates their lives and increases the joy of their families while they're living here on this earth. So as I say, I consider myself an educator. I educate by teaching, I educate by writing, and I'm just happy to be here with you tonight. Thank you for inviting me.
Thank you so much. And then last, but certainly not least, Calvin Allen.
Everyone, great to be with you. I'm Calvin Allen. I'll share a couple of things just to give you something to look at besides me. but in terms of kind of the work that we do, my answer to your question, Mona Lisa, is that we work with health leadership. That's our connection. And recognizing that there are already local leaders in Rockingham County who are working to make their communities healthier and more thriving. And so the work that Rural Forward North Carolina does is supporting folks who are doing that work kind of all over the state. Kind of the key thing here is, and that's someone who used to work in Rockingham County, Nick Aceves, who said in a meeting, you know, we could all be doing our jobs, and in this particular case around health, perfectly, and the county still might not be improving. And the idea is that we work together to create a vision for what better health looks like overall, and work in that way. And so Rural Forward North Carolina is a team of folks, and we provide those services there. A lot of kind of work bringing groups who are interested in certain issues to the same table to kind of work on those things, and providing support as needed and necessary. Thanks for having us.
All righty, thank you all so much. I think that has covered everyone as we get ready to jump in. And we are going to try to do everything in a timely manner. One of the things, I know we have some specific questions, but even in listening to everyone and looking at what we're calling this, and it says the resilient community, a conversation series. And so I'm going to pose a question or throw something out there from the beginning that we're going to catch in the end after everyone has gone through. But with that, we're talking specifically about the resilient community. We're having a conversation related to this. So what, and when I say what are you, I mean for each person that is represented here, or, you know, individually, collectively, what are we doing to foster or strengthen the resilience in our community? And so that's something that we're going to get back to toward the end, but I was just thinking as I heard everyone just kind of giving their brief intros. And so first of all, we're going to talk about some of the physical components. Nutrition for kids is based on the same principle as nutrition for adults. Everyone needs the same types of nutrients, of course, vitamins, minerals, carbs, all of those things, but children need a different amounts of specific nutrients at different ages. So what's the best formula to fuel kids' growth and development and support healthy food choices for adults? And with that, I think probably I will call on, let's see, Dr. Moyer.
I needed to unmute. All right, so pose that question to me one more time. Let me process it.
Okay, and I fully understand. What's the best formula to fuel kids' growth and development and support healthy food choices for adults?
So I kind of think about when I work with my godchild and her siblings, like she kind of takes her cues from her parents, but then when she comes to me, you know, I'm always an open book with nutrition. So I have all kinds of things for her to try. And she's like, well, we don't eat this at our house. I was like, well, just give it a try. And I always tell parents, you know, let them try it because they might enjoy it. Because I know, for example, our school system provides students their meals. And sometimes, you know, it may not look that appealing, but in hindsight, the kids actually think it tastes amazing. Yes, some kids may not like it, but they think it's amazing and it has the adequate nutrients that they need at the time that's going to fuel their growth. For example, like tossed salad, they think that a salad's just supposed to be lettuce and ranch dressing. Sometimes you have to, you know, for example, make it more appealing to the eye. So when I have people over, I kind of make it very colorful, throw different things in there. I personally am not a tomato fan, but I know it has lycopene in it and that's good for you. So I kind of just camouflage it in my salad and put a little bit of dressing. I do more salad than dressing. It's kind of what I tell the kids sometimes, try to do a little bit more salad than dressing. And then sprinkle that on the pieces that I know I'm not gonna, it'll camouflage that taste of that tomato, for example. And so then that way, you know, you're getting your lycopene in, but you're also enjoying whatever your dressing choice is. If it is ranch, you will have that. But I say, continue to keep it as an open book. Don't just shut the door on it for your kids if you don't like it, because they could like it and it has all the adequate nutrients. So I'm going to pass the ball to Jordan to see if he has anything to add, because he's also really good. He comes into our schools sometimes and does things with the students as well.
Wonderful. Jordan?
Yeah, so I'd echo what you said. The main point that I would like to get across is that we want to kind of shape a positive relationship between the child and their food from an early age. So you don't want kids to look at certain foods and be like, oh, that's yucky, or they get certain words and they attribute those to certain foods, right? Before they even tried it or smelled it or even tasted it. You know what I mean? So I want that point to be heard loud and clear. So that could be anything from the parents trying a food first and be like, oh, this is not that bad, or at least not giving their judgment until the child has tried it as well, and let them form their own judgment about a food. I know there's a lot of foods that I try that my parents or my brother in particular, that he hated. So because he hated it, I hated it. And it's just because of his idea of what that food was. Like, okay, no, I don't know what's one of them. I don't know, kale. Maybe he hated kale. Just because that, I wouldn't have eaten it. You know what I mean? So it's just kind of the people that you're around, they kind of determine what you're going to be exposed to and what you're going to be okay with trying. And then for the parents that are listening on, making sure that you're exposing your kids to these foods early and often. So the younger you can get somebody to try something, the more likely they are to eat it. And then once you kind of got them into the habit of trying new foods, they're more likely to continue that habit. So as they get older, they're going to be, spreading out or having a wider palate and consuming more foods. And that's the whole point of, most of the nutrition education that's out there is eating a variety anyway, or eating the rainbow, as we like to say. So getting that started early, so they're going to be trying kale or trying tomatoes, like Dee was talking about, or trying, I don't know, quinoa or whatever. Maybe they don't like it, but at least they've tried it and given their own opinion about it. Another thing I like to talk about is like having your kids have a hand in not only prepping the meals, but actually picking out what meals to have, and like having them have a hand when they're going to the grocery store. So not necessarily letting them like go wild and just grab every Oreo package off the shelf or whatever, so they have 14 different kinds of Oreos. No, that's not what I mean. But like, going through the produce section, you're gonna buy fruits and vegetables out of the way, and maybe let them pick a couple out. So maybe you typically get bananas and apples. Maybe the child wants strawberries. Cool, let the child have strawberries. Ultimately, that's a healthy choice, right? So maybe letting them have a hand in like picking what particular fruits and vegetables that we're gonna have, during our week. And then also having them have a hand in prepping the meal as well. A lot of kids are not gonna really want to try foods, but they're more likely to try food if they, put their hand in making it because they're proud of it. If I help make a pie, I'm gonna be more likely to eat that pie. I help make a Thanksgiving dish, I'm gonna be more likely to eat that dish. The same thing with kids. If they, had a hand in making the salad, even though it's something really simple, they're gonna eat the salad most likely because, oh, I made it, or they're gonna be bragging at the table, I made the salad, you got to eat it, and then kind of get them involved, and they're gonna be more likely to try things. Then offer choices as well. So don't just say, okay, we're having broccoli for dinner. Give them a choice of different vegetables they can have. Maybe we can have broccoli, cauliflower. Maybe we could have sweet potatoes. Give them a little option there, to where we're gonna have a vegetable either way, but at least they have a choice on what vegetable it is. And then bottom line overall is just getting them to eat a variety. So again, eating the rainbow is just the baseline, or where we want people to be. So just being open to eating a variety of different foods. But ultimately, not every food is going to have the same amount of nutrients or the same content in it. So ultimately, what we're going to have to do is eat a variety of different foods so we can get what we need to, stay healthy and live, active lives. I feel like there's one more thing I want to touch on, but it's slipping my mind.
Well, Jordan, while you're thinking, I'm going to tag on really quickly. Jordan's a part of our nutrition group for our School Health Advisory Council, and they've really been trying to engage the students when we were face-to-face by doing taste testings and parent nutrition nights. So whenever a school has like an event, we encourage each school's wellness team to offer options and work with their child nutrition department at that school to get those samples can. I know one time we did kiwi. We've done various things like some students had not even tried a strawberry or watermelon. So, you know, we gave them the option of those two and the kiwi and then the apple. So they had to tell us the difference between tasting the kiwi and the apple at one location as well. So they're really trying to engage the kids through various things by letting them do those taste testings, kind of like Jordan said, giving them the option to try which one that they want to see. Because we know if you give a kid a whole apple, it's not likely that they're just going to sink their teeth into it. But if it's chopped up, they're probably more than likely, because they can pick it up and go with it, then they're probably going to, you know, choose that option a little bit faster.
No, definitely. And that's what a lot of our programs in extension. And if anybody that's in this call or on this session is from a different county, there's an extension in every county, and they're most likely going to have an FCS agent. So if you don't need to reach out to me, you can reach out to your local office. But a lot of our programs in our Family Consumer Science department involve some kind of hands-on food prep. Not lately, you know, with everything going on, but typically it's some kind of, you know, the kids get to make something simple like a orange dip that goes with like their fruits or something like that, or maybe they get a hand in, you know, using some safe knives and chopping up some salad greens or something like that. But they get a hand in some kind of food prep, no matter what it is. And the same with our adult education as well. I know a lot of the issues with trying to get people to eat healthful foods is that they don't know how to prepare certain foods. And that's the same with me. I'm still learning how to prepare certain foods as well. It's, you know, it's a process either way. So, but getting that culinary literacy is a big part of that whole endeavor.
Okay, wonderful. Those were very, very good responses. There are several in our chat. If you'll kind of look at that from on occasion, you'll be able to see that people chime in, are making some responses to some of the questions. But one question, one of the questions says, how do we foster kids' growth and development and promote good food choices? And I know Jordan has spoken about that, but from a physician's perspective, can you kind of touch on that, Dr. Bland, as well? How do we foster the kids' growth and development and promote good food choices into adulthood? Not just about picking and choosing and picking things, but how can we do it now so that it conveys to adulthood? Dr. Bland, are you able to hear?
Oh no, Lisa, this is Stephanie Ellis. I think she must be frozen.
She must be, yes.
One thing, I'm not a physician, but I can say from a psychological standpoint, and from someone who I'll just self-disclose and say I've always had to think about weight my whole life, right?
Yes.
Is that I think kids, we have to remember kids learn about their relationship with food from an early age, right? From watching who's around them. And I think that's something that's also important to remember, and also taking the time to sit down and eat and have a space to eat. I know I have to be mindful of that. You know, we all kind of like to watch TV on the couch and eat, and sometimes that's okay. It's fun to do those things, but creating a space where you kind of save that time to eat and savor and actually feel full, and know that it's okay, that you don't have to eat everything on your plate. You know, I think some of us maybe came from a generation, I know I did, where you better eat what's on your plate, right? But sometimes when you're full, and that's okay to say I'm full and I'm ready to move on and go to the next activity. And so I think those are some things developmentally that is related to nutrition, you know, that or develop early habits for kids around choices they make and what type of food and how they have a relationship with food over time.
Thank you so much for chiming in and giving that response. I'm going to move on.
And may I just add to that, please? Now. May I add to that really quickly, please?
Sure.
Because Dr. Ellis is exactly right. You know, it's what you learn as a child, but one of the things we have to be mindful of is the children within our communities and the children who make up our communities and what they have access to. And so much, a lot of times, just demographically, economically, culturally, food is not the same. You find that in some communities, especially communities of color, there's a lot of processed foods. There's not the access to the fresher vegetables and the fresh foods, and that's not that variety. So that I can say is one benefit of having access to school nutrition, because school nutrition does do that. But that, even though kids even now have access to the meals through, the food service programs, if there's limited transportation to get those, right now, a lot of our families are in this time of isolation where you may not have access to that variety of fruits, a variety of vegetables, a variety of food. And so times like these could be even more detrimental to our physical health because of diet and what some of our kids even are experiencing. It just furthers the disparities that we have in our country, in our communities. So we just have to be mindful of that, and hopefully we can continue to get access. I know that all schools are doing everything that they can. I know that Ms. Thorne works diligently within, our high school community to try to provide backpacks in all of our schools, just so that our kids can have access to a good nutrition in this time of COVID, and not being to get that FDA approved program from school. So all of that to say, just please be mindful of the importance of what families and what kids have access to within their communities.
Yeah, thank you so much. And again, I think many of us were already aware of, disparity as far as health and nutrition are concerned. But with COVID, and then I thought about how when schools closed and the schools were still preparing meals for those who were in communities who had inadequate nutrition in their homes. And so we have to look at those things as well. Next, I want to talk a little bit, and I'm going to pose this question first off to Katrina and Kathy, so you all can catch this one, and then we'll move on from there. But the COVID-19 pandemic has exposed the inadequacy of public health systems worldwide, casting a shadow that we could not have imagined over a year ago. As the fog of confusion lifts and we begin to understand the rudiments of how the virus behaves, the end of the pandemic is nowhere in sight. We don't know what's going to take place or how long it'll be before it ends. The number of cases and the deaths continue to rise. And one of the things I want to ask right here, Cassie, you talked about, the statistics as related to infant mortality and things of that nature. So please shed some light on, what you found, especially now in light of COVID, any disparity or what's being done in our community with regards to this.
Yes, thank you for asking that question. There's so many layers as it relates to our community. Even before the pandemic occurred, the statistics is high and is growing, and even growing, especially during a pandemic. And even the 3 to 4 times more likely to die in childbirth, it doesn't matter how much money you make or where you live. It has a lot to do with stress and increased cortisol, right? Even Serena Williams have a birth story of the impact of what she endured during giving birth. And there's a whole historical perspective behind that too as well, but I'm not going to touch on that. But right now with COVID, there's a lot of barriers that exist right now that I really don't see that discussion being held, especially as it relates for doulas to have physical access in the hospitals to be with the patient. There's already a scare for women, especially melanated women. And I say melanated women because it's the melanin in your skin that I see. I have family in Sudan and different areas. They identify as Sudanese, not Black. So I say melanated because I am there to support all individuals, but specifically melanated individuals as it relates to these statistics that increasingly grow, right? But the main issue that I see now is the lack of support for doulas to be physically in these hospitals, specifically in North Carolina, right? This is a time that we should be there, but I also see that it appears to be a system where they're trying to use this as a financial gain, where you have to pay all these different fees just to be there for your client. But we don't work for the hospital. We are there to support the client. It is not so much of the fees and signing the paperwork, but also the overall aspect of a doula from a holistic approach is not to be confined to all the restrictions of the hospital, right? We are there to support the patient. And also the historical significance behind grand midwives and doulas and the history there and the mistrust in the hospital system, especially as it relates to just a trust factor. You know, my dear friend Katrina mentioned that too as well, but there's a history behind that. And being comfortable in your uncomfortable to really speak about these issues because it's there. And if we don't discuss it, these statistics are going to continually increase. But specifically for right now, there is not being discussed enough that the doulas to be physically present with their client, but you are able to be there with your client if you pay the fees, do the criminal record, all these different things. There shouldn't be all those barriers. The goal that I see for patients is patient-centered care. Doulas, we don't provide any type of medical support, but the World Health Organization has stated that we improve birth health outcomes. So especially during COVID, there should be all support to work collectively to really be there to support our patients. We provide the physical, spiritual support, emotional support, but most importantly, education. I say it's not informed consent unless you are informed. So knowing those different options as well. So an educator. I love how Dr. Bland mentioned that education is key, knowing your options. But right now with COVID, for doulas to actually be able to be present with their patient in the hospital, the fear factors increase even more, especially as melanated individuals. We are aware of those statistics, and then the complexity of COVID, and then the complexity of actually allowing doulas to be present with their client. So yeah, I just want to share that. But that's a great question. Thank you.
Thank you so much. And Katrina, if you could chime in on that same topic, please.
I will chime, and I'll start with the direct question. Who might have some insight into work being done in rural communities like ours to support folks in equity? Well, everyone does. That's the answer. Everyone has a responsibility to look at these health equities and disparities throughout our community and throughout our state, throughout our country. One of the things that I've seen with public health is that, as I mentioned earlier, people seem to have a stereotype of individuals who utilize public health, and they had this negative annotation about public health, starting back with the Tuskegee Institute study with the syphilis and that situation. So public health has always had this negative undertone about it, about themselves, and it still happens today. What I feel that we need to do as a community, and that's why it's so important for us to have our community partners and everyone on the same plate, on the same board, to kind of look at these things. These are tough conversations, and as I mentioned to someone before, that I don't have a lot of experience in this per se, but I'm ready to dive in. I'm ready to dive in because if we don't say anything, if we don't address these issues, we're not going to move forward at all. I've seen, even though in Rockingham County, there are more whites that are test positive for COVID-19. However, there's more death and suffering and hospitalization in the Black and Brown community. Number one, because they don't have that access to the care that they need. They're not informed. As I mentioned before, there's a trust issue when it comes to medication, because even when we're looking at the Tuskegee incident, and then we're looking at Henrietta Lacks, the young woman that died at 31 years old from cervical cancer because they use her cells to do research. That puts when you say research in the African-American community, it's like, oh no, you think of a guinea pig. Not going to be a guinea pig. And and I remember growing up and my grandparents would say, oh, we didn't go to the doctor for stuff like that. Mm-hmm. Well, that's because they were taught that they weren't worth going to the doctor. That was because when they gone to the doctor, they were treated in a certain way that just allowed them to feel that we'll just take care of it ourselves. We'll just keep it here in the house. And that was just a mindset that has been placed on us for years and years and years and generations. Not saying that we didn't take care of ourselves. Some of my grandmother's remedies were the best any pharmacist could ever hand me. And just knowing and having the information and just knowing you are worth excellent health care. You are worth the information. You are worth the knowledge. You are worth being aware. So no one person, no one entity can do that. Everyone has to come together. Even if you're not the most resourceful person in the room, but associate yourself with that so that you can just be a vessel to somebody else. We have our COVID response website. Well, we have a link on our website that just addresses resources for individuals that are suffering, because a lot of times the Black and brown people, they're the ones that have to go to work. You don't have the option to stay at home. You have to go to work. You know, you're worried about your child. Well, how can I work and my child is home? How do I feed my children and take care of my children if I have to work? And so it's so many things that are just disproportionately affecting the Black and brown community. And so we need to be there. And I've seen the suffering. I've heard the what ifs. I can't do this. And one thing that affects me is that with COVID, the two things that was just a staple in my life and in my children's life was church and school. Now you have neither. So your source of faith and your reliability of what was always constant is no longer there. In fact, of fearing you for yourself or your family and everything. So it's just a lot. And so that's why I like to get, you know, it was really important when I was listening to, you know, them speak about the mental aspect, because if you're not well mentally, then it just affects so many other things in your life. And so you have to have that support. You have to look at it from the big picture. Everybody is a part of this. Social determinants of health does not start with, did I exercise today? Did I eat a salad today? It doesn't stop when it says I lost my job. I mean, it's all of these factors that bear so much weight on the other that we have to look at it holistically. And I've heard that term, and I believe that, you know, we just have to look at things, look at it outside the box, because nothing is in the box anymore. And if we're going to improve our lives, improve ourselves as a society, we need to look outside the box. And
thank you. So Katrina, I was just thinking about something as you were speaking. You referenced Tuskegee, you referenced syphilis. Mm-hmm. And I thought about my husband and I have been engaged in some conversation here recently when we talk about the COVID-19 vaccine. Mm-hmm. So when we talk about resilience, when we talk about resilience in our community, when we talk about healthcare, can you just kind of shed some light on how all of that becomes a factor in where we find ourselves today?
It becomes a factor because it's always been, because of that lack of trust. Yeah. And that's evident. It's evident. And so and a lot of people, I've heard different sides of it. I was actually participating in an interview with Star News the other day. And I was surprised that he just came out and asked, well, are you going to take it? I was like, oh my God, you know, I'm public health. I shouldn't say no, you know, but I think I will, but I'm quite sure I will. But it's something to think about, because, you know, you hear some people say, well, this is not a natural disease, it's man-made. So how can something that is man-made going to help me and not harm me in the long run? And so it's so many different, you know, questions that people have. There's so much information we don't know, and it's coming at us like this. And everybody is just, they're just have so much COVID fatigue. We just want it over. You know, if I can see my grandmother, you know, if I can do this, maybe it's worth it. But we need to have more education. We need to have more information. And unfortunately, it's not available right now. We're in a haste, not a haste, but we're just trying to get some kind of normalcy back in our lives. And so I would advise anyone, you understand, you know, your situation, you understand your health, you understand your beliefs. You know, if you have questions, ask someone, because even though you believe it doesn't mean it's necessarily still true. You know, it's just been ingrained in you. And that's what you think and that's what you take because it comforts you. That's all you've ever known. So stepping out of that, you know, it will help them think of maybe in another term. If you say, okay, I'm going to take it, but you're just going to do it because of whatever reason, just have the information and make the right choices, not only for you, but for your family, for your community, because people are watching people and how they behave in certain situations. And so we have to behave in our best light all the time. If you don't know, you're asked. You know, and we just all need to serve as soldiers in this situation that we're in, whether it's, you know, with the COVID, if it's with politics, if it's regarding home, housing, food, and all of those other things. Everyone has something they can bring to the table, and they need to do that. It's not just the educational system. It's not just the law enforcement. It's not just any other, you know, entity. It's all of us working together because one situation relies heavily on another, and it heavily influences the outcomes of those situations as well.
May I add something to that, please?
Please, Dr. Bland, please.
Yeah. Wonderful what you said. You know, one of the problems that I have had this year in particular is getting people to understand that we, especially in the Black and Brown community, because of our health disparities, we need to think closely and seriously about taking our flu shots, and we need to think closely about taking the COVID shots, also vaccines. We need to understand that this is not Tuskegee. We have people in positions, National Medical Association, American Black Cardiology Association. We have people in positions who are making sure that these vaccines are good for everyone. This is not a test. This is true. This is real. We are dying. We need to understand that we have a high risk. People come to my office, they have diabetes, hypertension, and I say to you, you realize you're at high risk. And they look at me like, you know, really? Yeah, you are at high risk. You need to think about getting this. And what I say to them,
I think she must be frozen again.
Yeah. And
one of the things I hope she can jump back in, but one of the things I'm going to say that this panel is phenomenal, and the responses that you all are making to all of the questions, it's wonderful. We talk about trust and mistrust with regards to healthcare and things of that nature. I think what Dr. Bland was saying was, you know, it's something that needs to be heard, because there is a lot of fear. There is a lot of mistrust, distrust with regards to that. So these are things that need to be said. I do, again, I'm gonna move, but I do hope she'll be able to jump back in to finish what she was saying. Calvin Allen, I have not forgotten about you. I have something waiting for you right here. And so I'm gonna go to that, because like I said, I'm certainly I'm hoping that Dr. Bland, I'll see her pop back up. Calvin,
Mona Lisa, I'm sorry. Can I just add one more thing about what we're doing here in Rockingham County too?
Yes, ma'am.
As far as this, because I totally agree with Dr. Bland, because for some reason you know, some of us feel like we don't deserve excellent health care. You know, and when she mentioned, oh, am I at risk? It's a lot of people who feel that way. They know it, but they just can't wrap their head around it. So what we have applied for a grant with Kate B. Reynolds Foundation. And what we're trying to do is establish some kind of system of care for people who feel like they are uncomfortable. They need to find a medical home. They need access. They need guidance. They need sort of like a caseworker to help manage it. It's daunting. It's daunting. And to have someone that looks like you, sounds like you, from your community, working for you and your health and working as a team, that can just change someone's way of thinking, the whole health, you know, trajectory for their entire family and community. So we're hoping to get this grant. I can go more into, you know, in detail about it, but I can actually tell Merrill, and he can share it with the group about how we can come together. That's one way we can come together as a community to address these issues.
Wonderful.
You're not alone.
Thank you so much for that information. And I see Dr. Bland has jumped back on, and we want you to jump back in, Dr. Bland.
Okay, I apologize for this. I'm getting a new carrier tomorrow. My internet. But I guess what I'm saying, and I really feel so strongly about this. I am so upset with so many people who are telling me that they're not going to get it, the vaccine. They've done some studies and they found that only about 53% of the African American population is willing to get, our different communities of color are willing to get it. We need to get these things. You know, I tell them, find somebody that you trust. I give people my Twitter account. I give people my phone number. They text me and ask me questions, but I want you to feel comfortable about it. Let us educate you about it and help you understand why we need to do these things. It is so very, very, very important.
Thank you. And I'm so glad you were able to jump back on.
I'm getting a new carrier tomorrow.
Thank you so much. And now for Calvin. It talks about, education leaders supporting healthy outcomes, but I'm going to pose this question to you. Is early childhood development enough of a focus in our community? And we're talking about, in our rural communities. So based on what you see, are we putting forth enough effort? What's going on in North Carolina in our rural communities?
And I would invite, I know we have folks who are with the Partnership for Children who, can probably speak to this more directly too. But what I'm seeing in several groups, so we get to work in several counties across North Carolina and several different partnerships for children. North Carolina has this great history of doing a lot of good work with early childhood development, but there is so much more room for growth. And still we see, as we were talking about disparities before, that a lot of Black and brown folks still lack access to true early childhood development resources as well. So the Partnerships for Children can only do so much. Part of it needs, there's a need to kind of expand the broader network, but also recognizing kind of how much there's more than just the basic education. There's a lot more kind of that needs to be built around folks who are doing early childhood education and getting them the resources that they need to provide the resources to the young people that they're taking care of as well. So there's just a whole lot more there, and I'm going to yield to our folks from the Partnership for Children.
Okay, there's someone from Partnership for Children.
I'm from the Partnership for Children. And if I could just add to that, I really agree on the need to address disparities in access and the need to address the needs of some of our early educators. I think sometimes when we think about education, we think, our high schoolers, our college students, we think about how important education is, and we use education, as a proxy for socioeconomic status. We talk about, communities where, a higher percentage of people have a bachelor's degree are more likely to be healthy and successful communities. We talk about these things, but a lot of the times we kind of ignore our earliest educators and our babies and very young children. I think that there's always been historically this perception that our babies are just kind of like little potatoes. They need a lot of care. And there was a perception up until the first part of the last century that babies didn't even feel pain. But more and more as we learn about infant brain development, 80% of brain development occurs by the time a child is 3. 90% of brain development happens by the time a child turns 5. So our early educators are, not just childcare providers, they are brain builders. And it's just crucial that we engage them in this conversation about health and resilience. And I think that it's also crucial to kind of weave the equity piece into it, not only when we talk about access, but when we talk about things like early educator salaries and their value in our community.
All right. Thank you so much for chiming in and giving some more information for that. And one of the things, we've talked about nutrition, we've talked about health, we talked about physical health, but also we know that emotional health, mental health, and spiritual health are also very, very important. I would be remiss as a preacher if I got on here and didn't chime in something about spiritual health. And I think especially in light of where we find ourselves now nobody would have ever imagined in an entire lifetime that we would be in the place we're in now with regards to this pandemic. And so while we look at people have been in close spaces who have not been in close spaces previously, when we look at families who have been forced to come together, be it good or bad, be it good parenting skills or not so good parenting skills, for all of these things, people have been forced together in a time that is unimaginable. And we've been, told we have to deal with it. But how do we deal with it? How are we able to move forward? Spiritual health. Faith plays a big role in many people's lives. It's that thing that people hold on to that gives them hope to get to the next day. Despite the fact that there are many people who are in homes who may be unemployed or whatever the case may be, it's their faith that gives them hope to go to the next day. And while they may not be as intellectually capable of doing what they feel is necessary for their children, because of that faith, that is the thing that gets them to the next day. That is the thing that gives them the hope and the drive to go on again, to work through whatever the matter is. So and then when we are in a place where, and I talk about, I go back sometimes to when I was a child. That's been a couple of years ago. But even then, how faith was such a great part of just how we lived every day. And even with smaller children, sometimes we don't see that as much these days. I've done some substitute teaching in some school systems, and things have changed a lot since I was in elementary school, a whole lot. And so when we think about what's going on in families, what's going on in households, what's going on with the economy, what's going on with the health, I want to know who can answer the question about resilience. Getting back to that question we started with from the beginning, the resilience, when we talk about communities, it's our babies as well. It's the grown folk, it's the grandmas, it's generational. It's just, when we look at some things, we say they're generational, they're cyclical. We see some things, but when we talk about a resilient community, how is it then that we know that we all have to work together? It's not just the response or the role of one organization or entity or person. And I so love Kathy because that village, sis, it does take a village. It does take a village, not just to raise a child, but it takes a village to live, y'all, a village. And so when we're talking about being resilient, speak on the mental health component as well as the spirituality component, because for resilience, for good resilience, for there to be a great bounce back and for us to get back into a position where we are at least as healthy as we were prior to coming into this thing, then how do we serve that? How do we work with that? Who wants to jump in on, I know I've said a lot, but who wants to jump in on that one?
I just wanted to touch on something quickly as it relates to Village Doula, the village concept. I see so much resources and information from everyone here on the panel, but also as a doula, I see that parent, I say gestational individual, regardless of who you identify as, sitting alone, pregnant, lost their job, afraid to go out because they're afraid of COVID, right? And then they don't know if they have COVID, but they don't want to get tested because I don't know how I'm gonna pay to get tested. I don't want to lose my job. Say I have to be out for 2 weeks, but who's gonna pay my bills? And then if they have 4 kids and it's virtual homeschooling, I have my technology out. Kids just got a laptop here in Guilford County. Food access, how am I going to go to the store to get, it's just so much. And then the COVID vaccination, we also not only had a pandemic, we had Black Lives Matter and all the trauma and triggers of those on the TV and reliving those experiences that our elders had spoken about. There's so much going on. And then the stress, I'm also a bereavement doula. Yes, we have bereavement doulas, birth doulas, postpartum doulas. I'm having more clients who are suffering miscarriages right now because of the stress and complexities, right? Because stress, even the fetus, it has an impact with that increased cortisol. It doesn't matter how much money you make or where you live. And seeing that on the media, the elections, there's a lot going on in a small period of time, right? So that young fetus is also hormonally the impact of those triggers and that stress. I just really say the biggest part of Village Sis Doula is the village. We have a lot of work to do. And I get emotional because I love what I do, but just that gestational individual contacted me and saying, being, as you mentioned, keeping the faith. There's a lot of individuals who are losing faith, losing their homes. Their children are failing in school. My son is second grade. We didn't do math like that. But there are a lot of people who are losing their faith right now. And just, I'm a certified health coach. So as a health coach, even with doulas and even with individuals who are not having children, just knowing that you can pick up the phone and there's someone to have a non-judgmental, safe place to speak with and listening. That does wonders for a lot of my clients, but just being that support for someone to listen, because a lot of people are losing faith right now. There's a lot of triggers for a lot of individuals. So yeah, so I'm glad to be sharing the information tonight and listening.
Wonderful. So Calvin, I'm going to go back to you. So the question that I posed, I think we're supposed to be getting out of here by 8:30. It is now 8:20. And I think this has been a wonderful conversation that has provided wonderful information. And again, I just want to say, before we move forward, even in the next couple of questions, for Rita and Georgina, thank you all so much for being a part of this. Morehead High School students, we applaud you. Thank you so much for being with us tonight. We wish you ladies well in your future endeavors, wherever it might take you. And so again, thank you so much. So Calvin, in closing out, the question that I posed initially was, what are we doing to foster or strengthen resilience in our community? And again, this is based on your position and you're traveling throughout rural North Carolina. So can you please shed some light of maybe some examples that you have seen, or just based on your knowledge, how it is that we can strengthen the resilience of our community?
I think one of the big things, and folks have named it well tonight, is to actually name the issues and find venues for them to be heard. Spaces like this one, to actually kind of voice the issues, the concerns, so that people who are feeling alone, the folks that we were just talking about, in terms of folks who are isolated and their spirit is low, that they can come onto Facebook Live and see that there are other people who are talking about some of the same things. They know that they're not alone. That community is really one of the best salves for it. It's not a complete solution, but it is a salve for that isolation. But overall, it starts with building some community and being able to name the issues, to hear that you're not alone. And then from there, and there are a number of folks who are doing that with data as well, that it's interesting that a lot of folks in the health world, like at the hospital, there are concerns like, can we share concerns and things that we're seeing with folks at the health department, and can they share information with folks that the people who are coming into the emergency room or to social services, and so people are beginning to figure out how to share information about the issues without kind of breaking privacy rules, and to be able to see as a community, these are the larger issues, and then coming together as a community to figure out how do we work collectively together to address the people who are most vulnerable in the community. But part of it is just being able to identify who are we talking about, and who are they in our particular community as well.
All right, thank you so much.
May I say one thing, please, ma'am? Okay.
Yes, ma'am.
All right. and I say this from this point of view, I'm a widow, but after 20 years, my husband was a minister, I'm a physician, and after 20 years, we used to say he was getting ready to diagnose and I was getting ready to preach. So I say that in my practice, what I try to do is whenever anyone comes in, the first thing that I do, I spend the first few minutes acknowledging this is not normal. It's okay that you don't feel so hot. It is okay. There's, and giving somebody the safety to say that they can get this out. They can say how they feel, that it's okay for them to feel this way. And I think that's the first thing that we have to do, make people feel safe, that it's okay, that this is just not normal. And then after doing that, then we can take care of a lot of other medical problems and help them go on. You'd be surprised at the number of people now who are willing to go into therapy, who were not willing to go into therapy, or just talk about things, but just making it safe for them to talk about. Thank you.
Dr. Bland, that was phenomenal. Thank you so much for jumping in and getting that part in. And what we're going to do now is, because time is of the essence, and we're going to be closing out shortly, we would just like a closing statement from each one of you. And Dr. Bland, I'll ask that, you just give a closing statement and we'll move forward from there. And just based on the conversation and the resilience and what's needed in our community.
Okay, first of all, let me say this has been a wonderful experience, and I thank you so much for inviting me. I think that we are more resilient than we think we are. I think that if we give people the chance to let them just be able to tell what's going on in that life, to have some places to talk and be able to be safe to talk, it makes a big difference. I think it's important that we try to have resources like we're having here that we can help people with. People want to know that they're cared for. They want to know that they're not alone. And if we can do safe places and give them those types of experiences, I think it would really, really help. There are lots of things out there that we can do. There are lots of processes that we can get a hold of. And I just hope that, more conversations like this with the resources that we've had on this particular call become more available, because this was a wonderful call. And thank you so much.
Thank you so much. Next, Tina. Take it.
Thank you. I would just say, don't underestimate the power of a relationship, specifically a culturally responsive relationship, in helping your neighbor, in helping the person beside you. Relationships make the world of difference in everything that we've talked about. Relationships make the difference in mental health. Relationships make a difference in spiritual health. Relationships make the difference in academics. And so it is so important that we build culturally responsive relationships to gain a better understanding of the people that we work with in our schools, in our communities, especially at a time like this. This has been phenomenal. I love the diversity in our panel. I love the diversity of the Zoom audience. That is what it's going to take for us to get through this, because we are going through. We will not stay here, and we will be okay together.
Wonderful. Thank you so much, Dr. Ellis.
I think a strengths-based approach is so important because we are resilient individuals. That idea that understanding trauma and being informed about trauma is important, but also being able to be focused on creating opportunities to learn skills that build resilience. One of the things that we're trying to do in the school system is we've developed trainers in the community resiliency model. And I would just encourage you guys to research that. It's through the National Trauma Institute out through California, if you haven't heard of it, and many of you may have. But I think being able to know that we can focus on those resilient skills. So many people have gone through so much, right? And they still keep going. It's that we kept going anyway, in spite of, right? And so I think just being able to focus on that and lift people up. And I love what Dr. Bland said about creating a safe space to share that. There's strength in being able to share what happened to you, and being able to feel safe to do that, and to be able to share how whatever that trauma was, how it impacted you. So I think that's just so important. And that's part of being resilient, to be able to do that and share your story with other individuals, and coming at it from a strengths-based approach. So that's what I would say.
Thank you.
And I'm so honored to be here, and thank you so much. I've thoroughly enjoyed listening to everyone.
Wonderful. Jordan, will you go next, please, with your closing statement?
Yeah. So one of the things I was thinking about as as we've gone along is just to be okay with asking questions, and understanding that it's okay not to know things. I'm pretty young. I'm still learning stuff all the time, and I like to ask questions because the only way you're gonna find out an answer is if you reach out to the person that may have the answer. So the people watching this, you see all these people that are community resources and people that are knowledgeable in their different fields. Just feel free to reach out to them and pick their brains. A lot of them have some knowledge they really want to share with you. But don't be afraid of us. Like, we really want to help, and I'm sure everybody else on the call wants to help as well. But sometimes we can't help if we don't know what to help with. So if you have a question or a concern, bring it up with us, and we'll do our best to serve you as we can.
Thank you, Calvin Allen.
Everybody's done such an amazing job of talking about folks who are dealing with health issues. I want to go one step beyond, and I want to talk about health leaders. So a lot of folks, including some of my colleagues here, what we're hearing from people all over the state is that, especially now in December, people who do work supporting other folks are also exhausted. And I just want to acknowledge that, and that there are resources as well for folks who are doing this work. And really, as people are talking about finding other people to talk to and build relationships, that people who have been caring, a lot of folks that they care about, some that they know and some that they don't know, but are doing the work to kind of help make things better in some really difficult times. I think making spaces for folks to share that they're having a hard time becomes even more important. So that's the only thing that I would leave is to make sure that we're making those spaces to kind of support other folks that we know who are caretakers, whether through their job or out of a mission of the soul.
Thank you so much. Next, Kathy.
Yes, I'm so glad that you mentioned caretakers too. Village says doula, we are a village, especially as birth workers. We support and uplift each other because this job is not easy, especially when you provide emotional, physical, and spiritual support. So it truly takes a village. I'm glad to know everyone here as well, because we all have different life experiences. We all have different expertise. We all have something to bring that light to encourage that resilience in someone else, but also resilience and strength. Strength is also being able to be vulnerable, right? Being able to say, look, sister, I'm tired, and allowing you to sleep is vent. So also knowing that strength is also that yin and yang between being vulnerable, and allowing yourself to feel those emotions, but then having that resilience to come out of that and even have a bigger testimony or something to share with another individual, because we all need each other and we are all God's children. And I'm so thankful to be with everyone here today on the panel. Thank you.
Thank you so much, Katrina. You're on mute.
I'm sorry. I just want to thank God for allowing us to have this opportunity to come together, and so many bright people doing so many wonderful things and trying to just to sustain yourself and your family, but yet your community too. And so I just love the idea. I've learned a lot. I've appreciate everyone's openness. And I think if we keep this mindset, we can do amazing things. I mean, it doesn't have to take forever. We can do amazing things. So thank you for having me. And everyone has done a wonderful job.
Yeah. Dr. Deirdre.
So thank you for letting me be a part of this panel. It's a wealth of knowledge on this panel. And I think, you know, the strengths-based approach is very valuable. And when I think about the community resilience model that Dr. Ellis talked about, that we were all trained in, you know, you just want to remind everyone to just, you know, take a step back, look, and you want to just, you know, kind of ask yourself, you know, how am I feeling about this moment? Don't do those knee-jerk reactions. Really take the time to process and kind of ground yourself and think about all the scenarios that we talked about, all the scenarios that go on in the world each day, and know that it's okay to not be okay, because you will be okay eventually. So I just thank you guys for your time tonight.
Thank you so much. And Elizabeth.
Hey y'all, I'm just in awe of the conversation that we've had tonight and all of the wonderful panelists here. It's been such an inspiring and energizing conversation. One of my favorite writers and thinkers, James Baldwin, said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." And I kept thinking about that quote tonight during this conversation, because I think that the issues that we've talked about tonight are such important steps to moving forward, so that we can not only face things, but create impactful change. So just thank you again to all of you for the beautiful conversation.
Thank you all so much for your final words, your closing statement. This has been absolutely phenomenal. This panel was superb, everyone in their own respective places and spaces. One of the things that was said is just, when it's okay to not be okay. And I think even more so than, you know, and especially for those of us, strong women, strong men, or whomever, even with the strength, it is okay to not be okay sometimes. And so just, you know, allowing people to be themselves, you know, to open, and a smile goes such a long way, y'all. No matter where we find, in the Walmart, wherever we might be, a smile goes such a long way for people who have been in their homes going through who knows what. And so just remember that, you know, we are all, every day, no matter where we are, we have the possibility of changing someone's entire life, no matter, it could be just a smile. Before I go away, I just want to say thank you so much to Meryl, NC100, who is a phenomenal person. He loves Rockingham County. He puts in the work, he hustles, he does. I am grateful to God for having met him, because I think he's a bomb.com. For Tango, who's also with RELC, with the Racial Equity Learning Community. Thank you for being a part of this, and for the two of you and your organizations just putting this together. This has been candid conversation, but it's been informational. And so who knows, for number 4, I will be the first person to vote to say, I think some of these folk need to come back and just have this continue, because it's been phenomenal. So, and again, thank you so much for asking me to moderate. And I'm going to turn it over to you now, Marilyn.
Okay, yeah, we'll get you out of here. Thank you so much. That was very nice of you. This was awesome. No, we ran a little bit late, but I'm so glad we had this conversation. I'm glad we were able to get together. This is iron sharpening iron, everybody. So I just really feel blessed and highly favored to be in the presence of everyone. And I wish you could get some more interaction with our Facebook folks. They had some really lively discussions about the FDA and historical trust of the government. There's a very interesting conversation there. They're quite pull into this one, but I'm looking forward to being able to have more conversations like this. And it's encouraging, right? These are tough times. We've had a very tough year. There are difficult times in our, you know, just our homes, our families' health, our families, politics, all this type of thing. So like having a forum like this is just really amazing to kind of like, you know, come together. And we're gonna, I can see like these little sparks that are gonna fly and be seeds to solutions down the road. So we've gotta keep on pushing that ball up the hill. For people who are watching on Facebook and you guys are here in the Zoom, we will put a post on our Facebook page. So obviously the people who are watching on Facebook, you are following us anyway, and you'll see a post. We'll have everybody's contact information for all the panelists, so you'll be able to reach them. And then obviously folks who want to get in touch with any of our panelists, you can always reach out to NC100. I will post the email address for Rockingham Equity, the Equity Learning Community, and NC100, and we can plug you into wherever. But we definitely gonna have to have conversation 4 be some type of mashup of this and something else, or maybe we dig somewhere. So I don't know. I'm just excited and glad you guys gave up a little bit of your evening. So thank you very much, and everyone have. Oh, and again, thank you again for our wonderful students that joined us. I want to make sure we do that, and for just their energy.
Meryl, to have a quick plug too, for those who were looking for resource, we have resources for resilience. I went ahead and
you went back on mute, Lisette.
I went ahead and put a link in the chat. It's resources for resilience. It's covered. We had 75 slots available. So much like CREM, resources for resilience uses a lot of similar techniques in building community relationship and how you deal with someone who's experienced some form of trauma and providing some sort of healing-centered engagement. This is an opportunity that's at no cost to you. Funders in North Carolina provided this grant for us to provide these slots. So check out the flyer, and then Meryl, if you have folks who are interested, I can always get them signed up if there are some classes available. So
okay, I will take that. I can share it on our Facebook page.
Yes, yeah.
Okay, I'll do that for folks watching on Facebook. I will share that. And Lori, thank you for saying it. Yeah, happy holidays for folks that we won't be able to see you before the end of the year, and happy New Year and all that stuff. Thanks again. Good night.
Good night.